The vagina houses hundreds of different types of microorganisms. Some tend to be especially dominant, such as Lactobacilli. These bacteria produce an acid that lowers the pH of the vagina, limiting what can survive inside and preventing certain infections. Usually, Candida yeasts are also present in small quantities. As a rule, these fungi are harmless. The immune system keeps them regulated while other microorganisms, how Lactobacilli fight and compete with them for nutrients and territory. But under certain circumstances, Candida fungus can cause infections. One species in particular, called Candida albicans, is commonly the cause of vaginal thrush or fungal infections, which affects 3 out of 4 people with a vagina. So, how exactly does a vaginal candidiasis happen? Candida albicans yeasts can change shape, and when the balance inside the vagina is disturbed, as increasing the pH or less microbes to compete, Candida albicans can take its disease-causing form. It multiplies and undergoes a metamorphosis, replacing their rounded structures by elongated shapes with the appearance of branches called hyphae. They then secrete enzymes that break down epithelial cells lining the vagina and penetrate the tissue. The cells of the immune system run to the site, generating some of the most well-known symptoms of candidiasis: itching, burning, swelling, and redness. They may also be accompanied by a change in vaginal discharge, the fluid that is often expelled from the vagina to keep it healthy and clean. During a fungal infection, the discharge can become thicker and whitish because the vagina is ruling out more candida and epithelial cells. Some big factors, like antibiotics and low immunity, can make people more susceptible to vaginal fungal infections. When someone's immune system is compromised, by illness or some other reason, your body may be unable to control Candida effectively. In the treatment of bacterial infections, antibiotics kill harmful bacteria, but can also eliminate the beneficial, such as Lactobacilli, allowing Candida to multiply more easily. Many other factors also help set the stage for candidiasis. Hormonal and dietary changes modify the vaginal microbiome. Semen is relatively basic, so it can interfere with the pH of the vagina. Tight, non-breathable and wet clothes accumulate moisture and contribute to a more favorable environment for Candida. Soaps can damage the protective mucus lining the vagina, facilitating the permeability of Candida. That's why many doctors recommend only washing the vulva gently with water. It is important to clean from front to back, to avoid bringing more Candida, also as other microbes potentially harmful to the vagina. Most fungal infections are mild and resolve within 2 weeks. Antifungal drugs in general provide reliable treatments, reducing the number of Candida cells, allowing the immune system and other microorganisms to regain control. And, interestingly, the solution to treat some fungal infections could be more fungus. Preliminary studies with probiotics containing harmless yeasts that we use in the fermentation of beverages and cooking proved promising in keeping Candida under control while reducing inflammation. However, some fungal infections require more extensive therapies. About 5% to 10% of people with vaginas experience at least 4 fungal infections a year. For some of them, the cause seems to be genetic. Some people have genetic variants that make it difficult for their immune system to recognize and regulate Candida cells. But why many have recurring infections is not yet clear, and it requires much more research. In fact, the same happens with basically everything we just talked about. We don't know enough about the vaginal microbiome, probably because of stigma and underfunding, when it comes to topics which traditionally fall under the category women's health. For example, while erectile dysfunction affects a much smaller percentage of people than vaginal candidiasis, there is about 6 times more research on the subject. Hopefully, we'll soon have a better understanding of the many crowds of microorganisms that inhabit us, and the best way to keep them in balance. I hope this video helped you. I left the diet link Candida Diet Solution here in the video description to help you.